Good afternoon, Dr. Schoonraad. You're welcome to continue. There's just a few background noises, but otherwise you're welcome.
Thank you very much. Sorry about that, Marlies. Hi, everyone. My name is Nadia Schoonraad. I'm a mom of two. I'm also the treasurer of the SAAPD. I am a clinical teacher at the University of the Western Cape, and I also have a private practice in Claremont that I work at. I'm lucky enough to be involved in quite a few community outreach projects that are really close to my heart. For today, I'll be speaking about my kid knocked and broke a tooth and what the importance is of our clinical dental treatment. Accidents can happen anywhere and at any time. Knowing exactly how to handle a dental emergency can mean the difference between saving and losing your child's tooth or preventing some long-term damage to the area. So what do you do when an unstoppable force meets an immovable object? SADA and the SAAPD would like to pass on a few helpful hints to parents about the do's, don'ts, and the possible treatment options when it comes to dental traumatology. When dealing with a dental emergency, time is of the essence. And knowing whether or not the tooth involved is a permanent tooth or primary tooth is of paramount importance. So this is how one can easily identify the difference between a permanent tooth and a primary tooth. So baby teeth are basically 20 in number. They're small and they're really white, and they start erupting at about 6 months of age. They are usually completely erupted by 2 to 3 years of age. Permanent dentition, we have 32 teeth in number. They're usually a lot larger, and they start erupting when they're about 6 years old. It's normally completed at about 18 to 21 years old. So the biggest difference is definitely the kid's age. These are the most common types of dental traumas to the permanent dentition. So we're going to be talking about concussion, subluxation, extrusion, lateral luxation, intrusion, avulsion, infraction, enamel fracture, enamel and dentine fracture, enamel, dentine, and pulp fracture, crown root fracture without pulpal involvement, and then with pulpal involvement, as well as root fracture to the alveolar bone. So what do you do? Right? Here we have a breakdown of possible dental trauma and how it's usually treated. Enamel fractures, you'd normally not see any radiographic abnormalities. Dentally, we would just smoothen off the sharp edges. When you have an enamel and dentine fracture, once again, radiographically, you wouldn't really see any radiographic change, but your treatment would involve a restoration. You would then follow that up in a 3 to 4 week period. When one has a crown fracture with an exposed pulp, radiographically, one would be able to note the stage of root development, which is really, really important to the treating dentist. Treatment at all costs would involve saving the vitality of a tooth. A possible partial pulpotomy is often the treatment that would be preferred. The treatment also largely involves the cooperation of the patient. Follow-up, we do that after 1 week, 6 weeks, and generally after a year. The other types of dental traumas is fracture that involves enamel and dentine, and usually we have fractures that would extend into the gingival margins, and that can be seen radiographically. Depending on the clinical findings, 2 treatment scenarios may be considered. When you have a fracture removed, when you have a fragment, you have to normally remove the fragment, and usually you have if there is a very large fracture, extraction of the tooth is sometimes needed. When you have an alveolar bone fracture, repositioning of the tooth is very important. Repositioning of the tooth can be seen on the radiographs. It's usually quite important for you to take more than one radiograph. Usually what we would do is we would take 3 radiographs. One, doing a bisecting the angle technique, and then you would take 2 from either side so that you could see what the difference is. You would always follow up these patients after a week, after 3 to 4 weeks, and then after 6 to 8 weeks, and after a year. The signs of apical periodontitis or inflammation or root resorption is something that is very important to note. When you have disturbances in your permanent dentition, or you have any disturbances that requires extraction, extractions need to be done as soon as possible. There we go. So when you have lateral luxation, the tooth is displaced usually in a palatal or a lingual or a labial direction, and the tooth would sometimes be immobile. Your follow-up periods are after a week, after 2 to 3 weeks, and after 6 to 8 weeks. Thereafter, you'll follow up these patients in a year's time. It's very important that these teeth are sometimes asymptomatic, and your clinical and radiographic signs of a normal or healed periodontium is very important for the developing dentist to note. When you have luxation, lateral luxation, you often have dark discoloration of the crown. Okay. The last type of treatment, there we go. So it's very important for us to note that if we just have a quick breakdown of all of our treatments, if your tooth hasn't moved or the tooth has just chipped, it's very important for you to schedule an appointment with the dentist for an evaluation. If the tooth has moved in position and is very loose, you gently have to try and reposition the tooth by a dentist. This will allow the tooth to heal properly. If the tooth is very mobile or just barely attached to the gum, do not try to reposition the tooth. If the tooth completely comes out of the socket, do not put the tooth back in the socket if it is a primary tooth. Lastly, if you cannot find the tooth at all, two things might have occurred. Your child has either swallowed your tooth, so it would be very important to go and see the dentist and potentially have to take an X-ray. If the tooth has been pushed into a socket, an X-ray is very important because it would determine whether or not there is viability for you to re-implant those teeth. My take-home message for today would be that prevention is truly better than cure. There is a number of simple precautions that one can take to avoid an accident and injury to your child's teeth. If you have wear of your child's teeth, it's very important to note that they visit a dentist every 6 months. Your child should also wear a well-fitting mouth guard when doing some sports activities, such as biking, skating, or riding a scooter. Children should also be instructed to use scissors correctly and never to use their teeth to tear or cut things. One should always supervise young children and not allow them to run around with objects in their mouths, such as toothbrushes and pencils. In your house, you can always try to reduce tripping hazards, such as gates, and block off stairways so that young children cannot get access on their own. Lastly, visit your dentist every 6 months to make sure that your child's teeth are healthy and strong. Thank you.
Thank you, Dr. Schoonraad. We appreciate it. Have a great day further. I'm going to end the webinar now.
Thank you.